Today topic of discussion infraction. Infarct, an area of ischemic necrosis. What is infarct? An area of ischemic necrosis caused by occlusion of either arterial supply or venous drainage. So, ischemic necrosis caused by occlusion. Occlusion means blockage of either arterial or venous supply. Next, infection. Infection is a extremely important clinical illness. Okay, infection is an extremely important clinical illness and one of the major causes of death worldwide. Then next, um, discuss about causes of infraction. Nearly myocardial infarction, cerebral infarction, pulmonary infarction, bowel infarction, ischemic necrosis of extremities. So, common causes myocardial, cerebral, pulmonary, bowel, and ischemic necrosis of extremities. Causes nearly all infarct result from thrombotic or embolic arterial obstruction. All infarct result from thrombotic or embolic arterial obstruction. Occasionally, infraction are caused by some other mechanism. They include local vasospasm, bleeding into an arthromatous black, extrinsic vessel compression by a tumor. For an example, extrinsic vessels compression by a tumor. For an example, then rare causes. What are the rare causes? Torsion of a vessels such as torsion of testis. Then interstitial volvulus. Then traumatic or vascular compromises by edema such as anterior compartment syndrome, venous obstruction can causes infraction, common outcome congestion and edema. So rare causes torsion of via vessels such as torsion of testis, interstitial volvulus, traumatic or vascular comprises by edema, then anterior compartment syndrome, although more common outcome is venous obstruction can causes infraction. Common outcome is congestion and edema. Next, venous obstruction, collateral channel rapidly open up and permit vascular flow. So venous obstruction, the collateral channel rapidly open up and permit vascular flow. This one improve the arterial flow. This one improve that arterial flow to that affected organ or tissue. Therefore, these tissue are less likely to get infraction. So, vascular obstruction, collateral channel rapidly open up and permit vascular flow. So, this improve arterial flow to affected organ or tissue. So, therefore, those tissue are less likely to get infraction. However, organs with a single efferent vein such as testes and ovaries. Organ with a single efferent vein such as testes and ovaries. are more likely to get infracted because they have single vein. Its obstruction will increase the pressure with the tissue as no collateral present, and this will ultimately lead to impaired arterial flow followed by ischemia and infraction. Obstruction will increase the pressure within the tissue as no collateral present, and this will ultimately leads to impaired arterial flow followed by ischemia and infraction. And sometimes capillary obstruction may causes capillary obstruction may also causes infraction. For example, vasculitis of capillaries may narrow down the capillary lumen, causing ischemia and necrosis of the affected area. Sometimes capillary obstruction may also causes infarction. For example, vasculitis of capillaries may narrow down the capillary lumen, causing ischemic and infraction of the affected area. In addition, disseminated intravascular coagulations, bronchite, and fat embolism may also causes infraction due to capillary obstruction. So, in addition, disseminated intravascular coagulation, frostbite, and fat embolism may also causes infraction due to capillary obstruction. Now, let's discuss about a different type of infarct. They can be categorized into many types. Predominantly, they are categorized into pale or red infarct, septic or blunt infarct, arterial or venous infarct. First one is pale or red infarct according to their morphology. In addition, they are categorized into septic and arterial or venous infarct. Pale anemic infarct occur with arterial occlusion in solid organ. So pale anemic infarct occur in arterial blockage in solid organs like kidney, heart, and spleen, which have end arterial supply. So here that infected area, pale color, pale infraction in spleen. As soon as occlusion occur, blood seeps into the affected area, and venous backflow also occur. So that infract is initially red in color. So here occlusions occur in solid organs like kidney, heart, and spleen, because which have end arterial supply. This one is the infarct area. As soon as occlusions occur, blood seeps into the affected area, and venous backflow also occur. So initially infarct area red in color. With time, extravasated red cells undergo enzymatic digestion. Extravasated red cell undergo enzymatic digestion. So the infract become pale. Ultimately, infected area become fibrosed. Sometimes calcification may also occur, and secondary infection leads to abscess formation. So, extravasate red cell undergo enzymatic digestion. Then infract become pale, ultimately infected area become fibrosed. Sometimes calcification also occur. Secondary infection leads to abscess formation. Second one is red infract. First one is fail completed. Second one is red infract. Um, Occur in the following settings such as venous occlusions. Venous occlusion such as an ovarian vein obstruction. Second, in loose tissue, lungs, blood can collect in the infracted zone. Then, in tissue with dual circulation, in tissue previously congested by sluggish venous outflow. Then, when the flow is re-established to the site of previous arterial occlusion and necrosis. For example, following angioplasty of an arterial obstruction. So, red infract, venous occlusion in loose tissue, lungs, then tissue with dual circulation, in tissue previously congested by sluggish venous outflow. When the flow is re-established to the site of previous arterial occlusions and necrosis. For example, following angioplasty of an arterial obstruction. Most of the time, extravasated red cell in hemorrhagic infractions are phagocytosed by macrophages. Extravasated red cells in hemorrhagic infractions are phagocytosed by macrophages. So here heme is converted into hemoseridine. So it producing brownish appearance to that infract because heme converted into hemoseridine. Most of the time of that infract tend to wedge shaped. Occluded vessels at the apex and periphery of the organ forming the base. That diagram is attached. This one is the infract in spleen. It producing yellow color indicate apex. Red color indicate base of infract. If the base is a serosal surface, can be fibrinous exudates on the surface. Acute infract are poorly defined and slightly hemorrhagic due to seepage of blood. Acute infract are poorly defined and slightly hemorrhagic due to seepage of blood. With time, the margins are better defined by a narrow rim of conjunction due to inflammation. Margin are better defined by a narrow rim of conjunction due to inflammation. In the brain, the process is somewhat different. Infected area undergoes a rapid liquefactive necrosis and become a fully filled cyst surrounded by gliosis. Liquefactive necrosis and become a fully filled cyst surrounded by gliosis. In the intestine, wet gangrene develops in the infract as a result of secondary infection by intestinal flora. Next, septic infract occur when infected cardiac valves, vegetation embolies, or microbes seeded on the necrotic tissue. In this instance, the infract is converted into an abscess. Ultimately, this abscess become fibrous as a result of healing process. Septic infarct occur when infected cardiac valve vegetation empalize or when microbes seeded necrotic tissue. These instance the infarct is converted into an abscess. Ultimately, this abscess become fibrous as a result of healing process. Now let's discuss about the factors that influence development of an infarct. First one is nature of vascular supply. Availability of the an alternative blood supply. Simple word, presence of collateral circulation. For example, lungs have a dual blood supply from pulmonary and bronchial arteries, which provide protection from thromboembolism induced infarction. Similarly, liver has a dual hepatic artery and portal vein circulation. Hand and forearms with their dual um, radial and ulnar adrenal supply are usually resistant to infection. So lungs, liver, hand and forearms have dual blood supply are usually resistant to infections. In contrast, renal and splenic circulation or end arterial and vascular obstruction generally causes infection. In contrast, renal and splenic circulation or end arterial and vascular obstruction generally causes infection. Second most important determinant is rate of occlusions development. Rate of occlusions development. Slowly developing occlusions are less likely to cause infection because they provide enough time to develop alternative perfusion pathways. For example, three major coronary arteries are interconnected by small interarteriolar anastomosis with minimal function in normal condition. Three major coronary arteries are interconnected by small interalveolar anastomosis with minimal function in normal condition. If one major coronary artery is slowly occluding, flow within the collateral increases and it may be sufficient to prevent infractions. Another one is vulnerability to hypoxia. Not all the cells are equally sensitive to hypoxia. For example, neuron can live without oxygen for only 4 minutes. But if we take myocardial cells, they can live for about 20 to 30 minutes without oxygen. And if we take fibroblast, they can live forever hours without oxygen. So neuron 4 minutes, myocardial cells 20 to 30 minutes, fibroblast an hour. Final one is oxygen content of cells. If we take an otherwise the normal cell with partial obstruction of a vessels due to some reason, an anemic patient with the same degree of occlusions, the anemic patient is more likely to get an infractions over the normal persons. So in this video discussed infractions and other types. Causes: venous obstruction. Types of infraction. First one is pale, red infractions. Thanks for watching.